Hi, my name is Elizabeth Wilson. I'm a graduate research assistant with Weighing In, a program of Children's Mercy. I'm going to talk through the 2020 Kansas City Regional Report Card on physical activity for children and youth. So throughout this presentation, I'm going to walk through each kind of section of the report card and discuss the main points. This is to give you an overview and an in-depth discussion of the report card, which you can read as well on your own, but this is sort of more to add a little nuance and discussion around each indicator and the background of the report card. I'm going to flip through the first few pages of the report card and spend a little time here talking about the overall summary, just the background of the report card. So we created this regional report card based on a national physical activity report card, which was produced by the Physical Activity Alliance, formerly known as the National Physical Activity Plan Alliance. So we used the same 9 indicators of physical activity that report card used, and we added a piece where we rated the data quality available in each indicator. We focused on the region of Kansas City, primarily the 4 counties that comprise the bulk of the metropolitan region, which are Clay and Jackson counties in Missouri and Wyandotte and Johnson counties in Kansas, but we recognize there are counties which are also comprising the Kansas City region, and so when available we use data in those counties as well. We initially collected data from publicly available sources in each of the indicators, and through discussion with a main advisory committee, which is myself, Dr. Jordan Carlson, and Dr. Robin Shook, we came up with preliminary grades, which we finalized with discussion with our core work group members. These are the data sources that are used to support the grades that we assigned, and you can see that several of them come through national sources such as the American Community Survey and the Behavioral Risk Factor Surveillance System. Some of them are reports and studies that have been conducted by government agencies, and a couple of them, like the Missouri County level study, are state sources. There's also the State of Children's Health, which is the 2019 Community Health Needs Assessment for the Kansas City region, which was done by the Children's Mercy Hospital. And so you'll see throughout the report that's one of the sources that's most applicable to the local region. Here you have a few of the abbreviations that you'll see throughout the report, and it's a good reference just to check that you understand what terms we're using. Here is the data quality standards and grading criteria for the indicators. So since it's a report card, we use sort of an ABC type of scale. You can see, for example, an A is anywhere between 80 to 100% of children and youth are meeting the criteria, the standard in that indicator. So it's broken down such that an A minus represents 80 to 86% of children meeting criteria standards, 87 to 93% meeting criteria standards would result in an A grade, and then an A plus is 94 to 100%. So you'll see throughout the report card that grades largely correspond to the data that we found in a given indicator. Where they don't correspond, there's some discussion in the individual indicator as to why that is. It could be that in some cases the data are just not there to support a certain letter grade, and so given that the data aren't addressing all of the indicator criteria sufficiently, we aren't able to, with confidence, assign a given grade. So through the discussion with our core work group members, we made a call as to where to place the grade. You also see on this page the data quality standards, and so the standards are listed down at the bottom. These are standards of data quality that we felt were important when applying data to a given indicator. So it's important that data are reported at the local level, that they're sufficiently recently reported, as in like around less than 3 years, that there's a sufficient sample size, that there is a representative sample, and that they're publicly available. So if data met all those standards, then they were given a grade of an A. In some cases, indicators may have met those standards, but then did not match up with the grading criteria. And so in those cases, we may have lowered the data quality grade, and I'll address that in our discussion here. Here's the table with the core work group members and the organizations. And this is a good reference if you are interested in a given indicator area and you'd like to know more. The core work group members here might be good contacts. This is a table with all the data sources that we used and a rating for them. So in addition to the rating, we list out the criteria that these data sources meet. And this is a good reference if you are interested again in a certain area or an indicator and would like to go to the data that we used. This table will be handy to give you a sense of what sort of data source it is. Here's the report card for 2020, and you can see listed are both the grades and the data quality grades for each of the indicators. So again, these 9 indicators were taken from the National Physical Activity Report Card on physical activity in children and youth. And those indicators are overall physical activity, which for 2020 was given a grade of C-, sedentary behaviors, which we gave a grade of C, active transportation, which we gave a grade of F, organized sport participation, active play, physical fitness, family and peers, school, and community and built environment. And on the screen, one of the things to draw your attention to is some of these indicators we weren't able to assign a grade, and in others, we may have assigned a grade only to the data quality and not to the indicator itself. And certainly there's a range here from on the high end a B- in organized sport participation to an F in active transportation. So you can see that, overall there's a pretty big range of how well we're doing, and in some areas we're not even collecting data to be able to make a rating of that indicator. So the first indicator is overall physical activity, and I'm going to go through this indicator kind of discussing the key findings and the considerations that, while they are not informing the grade, do inform our understanding of this indicator. Now each indicator has been rated based on at least a primary criteria, and in some cases there will be secondary criteria. The primary criteria in physical activity, overall physical activity, is just the percentage of children and youth who meet the physical activity guidelines for Americans, which recommends children and youth accumulate at least 60 minutes of moderate to vigorous physical activity. So we assigned a grade of C- in this indicator, and then you also see a grade for the data quality, which we gave an A in this indicator. The primary criteria was evaluated with a few key findings, the first of which is that about 42.5% of children ages 2 to 17 in the four-county area were active at least 60 minutes every day. So that 42.5% of children falls into the range that corresponds to a C-. There is some variability here, and you can see that in the other key findings listed. For example, fewer teens engage in 60 minutes of daily activity compared to younger children. There's some other considerations which, again, these aren't what we base the grade on, but they do enhance our understanding of the indicator. And so those come from state-level sources in this case. The CDC reports that 26.5% of Kansas and 28.6% of Missouri high school students engage in at least 60 minutes a day of physical activity. There's also information about the percentage of adults reporting no leisure time physical activity. So the higher this percentage, the less, the fewer percentage of adults actually engaging in some physical activity. So you can see that those percentage estimates range from 16 up to 30% across the region. So we move on then from the findings to the discussion of the indicator grade. And so while the indicator was given a grade of a C-, we know that that encompasses some amount of variability, such that, there's some children who are more, there's some populations that are getting more physical activity than others. As we already said, that includes older children getting less activity than younger children, or fewer older children getting sufficient activity compared to younger children. There's also variability in demographic groups broken down by household income. And then we also include a discussion here of the data sources for the key findings. So the discussion emphasizes the Children's Mercy Health Needs Assessment. This is going to show up in multiple indicators as the primary source of data, and it is a good data source based on the grading criteria that we came up with. So it's a local data source. It is comprised of a survey of children in the region that's representative and of a sufficient sample size. It's publicly available, and it was recently reported. However, there's some things that are missing here. For example, we didn't look at muscle and bone strengthening and types of activity, which is also important for physical activity. The other data sources that are included in this indicator are those at the state level, which is the Youth Risk Behavioral Surveillance System and the Behavioral Risk Factor Surveillance System. And we also included information from the Missouri County level study. But again, these inform our discussion around it, but they did not influence the grade. We also have recommendations in this indicator, and you'll see these throughout each indicator, there being recommendations. A lot of our recommendations focus on surveillance, where we'd like to see local surveillance harmonized with national surveillance so that they use the same verbiage to measure physical activity. We think that local surveillance should also include those questions about muscle and bone strengthening exercise, and be able to look at disability status in order to evaluate the presence of disparities by ability status. We also think coordinating with ongoing research projects to include objective measures of physical activity would be helpful, since most measures right now of physical activity are parent or self-report. All right, I'm going to move on to the next indicator, which is sedentary behaviors. So sedentary behaviors are evaluated based on the primary criteria of the percentage of children and youth spend engaging in 2 hours or less of screen time per day. So the grade for this indicator is a C, and then the data quality grade was an A. I'm going to get into the key findings for this indicator. So the key findings here are based on the Children's Mercy Community Health Needs Assessment again, and they found that in the 4-county area, children 5 to 17, 40.7% had 3 hours or more of device time per school day, which corresponds to about 59.3% of children having less than 3 hours of device time per school day. Now again, there was variability in these findings, such that children in Wyandotte County had device time greater than 3 hours, 44.8%, while Clay, Jackson, and Johnson counties all had children, only 40% of children having device time greater than 3 hours per school day. Device time also likely increases with age, where only 29.4% of school-age children 5 to 12 spend more than 3 hours on devices in an average school day, compared to 59.9% of those 13 to 17. There's variability also by household income level and by race and ethnicity. We include some other considerations in this indicator from the CDC, which are state level. So they reported that 14.5% of Kansas and 21.1% of Missouri high school students watch television at least 3 hours per day, and 34.4% of Kansas and 42.3% of Missouri high school students played video or computer games greater than 3 hours on a school day. Now, the discussion emphasizes that sedentary behaviors are relevant to physical activity in that they displace physical activity. So we'd like to see, less sedentary behaviors. So the grade in this indicator is adjusted from the level suggested based only on the findings from the Community Health Needs Assessment, because while 59.3% of children spending more than 3 hours on a device per day could suggest a grade of a C+ for the indicator. There's a mismatch between the data and the indicator standard, and because of the variability in race and ethnicity and income, we lowered the grade to a C. Because again, the indicator evaluates the percentage of children and youth spending less than 2 hours per day on screen time, and the criteria are not, the data in this indicator are in regards to children and youth who spend greater than 3 hours. So again, because of that disparity between the indicator criteria and the data available, we lowered the grade. Again, the data come from the Children's Mercy Health Needs Assessment, which is a good data source, but because the criteria and the data don't align in terms of the number of hours of screen time, we did consider lowering the indicator data quality grade as well. And again, in this indicator, there are some recommendations. We think that primarily it'd be helpful to align the question wording so that it lines up with that of the criteria for the indicator. We also think that surveying a wider age range of children would be important, since screen time recommendations include children under the age of 5, also limiting their exposure to screens. And it can be helpful to assess sedentary behavior through means other than self-report surveys, so through accelerometry or ecological momentary analysis. And of course, we think it's important to work to reduce sedentary behaviors, such as device time, through cooperation with local community leaders. So now we're going to get into the next indicator, which is active transportation. And the primary criteria in this indicator is the percentage of children and youth who use active transportation to get to and from places, such as the school, parks, malls, friend's house, etc. You can see that the grade for the indicator was an F, and the data quality grade in this indicator is a C. The grades based upon the key finding from the Children's Mercy Community Health Needs Assessment that found 5.7% of children and youth ages 5 to 17 walked to school in the total service area, which for the 2019 Community Health Needs Assessment was Johnson and Wyandotte counties in Kansas and Jackson and Clay counties in Missouri. We have a couple other considerations that inform our discussion around this indicator of active transportation, and these are just the rates of people 16 and older who usually walk to work. We had 6 counties here that we were able to get information about, as well as the Kansas City Metro, and you can see that the rates of people walking to work is between 1 and 2%. So active transportation is an important source of physical activity that contributes to meeting the overall recommendations for physical activity. While the data source here only assessed the mode of transportation that children use to get to or from school, it was so low, 5.7%, that we think a grade of F is justified, even if, there are more children who are walking to friends' houses or to parks and things like that. It's unlikely that we're going to be meeting the cutoff point of 20% to get a grade higher than an F. And also, given the low rates of walking to work, it does seem that overall active transportation is quite low and falls behind benchmarks. So again, we discuss a little bit about the data quality here. It's a good data quality source in the sense that the Children's Mercy Health Needs Assessment is a local and recently reported source, and it's a representative and sufficient sample, but because it doesn't measure all kinds of active transportation, we made the decision to lower the data quality grade to a C. There's a couple other data sources that we used when we looked at our other considerations, including the county level study in Missouri and the American Community Survey. And these are county level sources, but they're only looking at adults 16 and older. Our recommendations for this indicator include improving the local surveillance of all kinds of active transportation, so expanding beyond walking to work or walking to school to things such as biking to other destinations, and also we think that partnering with local organizations could enhance our ability to measure active transportation. We think that local policies could be enacted to enhance active transportation, as well as improving infrastructure to improve and encourage active transportation. So our next indicator is organized sport participation. The primary criteria in this indicator is the percentage of children and youth who participate in organized sports and or physical activity programs. We assigned this indicator a grade of a B- and a data quality grade of an A. So the grade for the indicator is based on this key finding from the Children's Mercy Health Needs Assessment, which found 60.1% of children and youth 5 to 17 played on at least one sports team in the past year. The other considerations in the indicator are regarding high school sports participation in Missouri and Kansas at the state level, and about 56.4% of Missouri high school students and 58.3% of Kansas high school students are playing on a sports team. So organized sports is relevant to overall physical activity because, again, it provides opportunities for children and youth to be physically active on a regular basis, and additionally, it creates the ability to be active throughout the lifespan through learning a sport that one may enjoy and be able to build those skills for physical activity at an early age that can carry over into adulthood. So we do have pretty high rates of physical participation in organized sports in the region, which supports a grade of a B-, 60.1%. But unfortunately, there's not much more detailed information by demographic groups, such as age, gender, household income, race, or the county in which children live. So there are national trends suggesting that there's some variability and disparities by sport participation by family income or gender, for example, but we can't speak to that on the local level. So again, our data source for the findings in this indicator are from the Children's Mercy Health Needs Assessment, and it was a good data source, and in this case it pretty much aligned with the criteria for the indicator. We used the Youth Risk Behavioral Surveillance System from the CDC to provide that state level data, which informs our discussion of the indicator more broadly, but do not influence the grade that we assigned in the indicator. And then we have a couple recommendations for this indicator. We think that surveillance sources should provide more detailed rates of sports participation within demographic groups, because that can help us identify populations that may not benefit from the same rates of participation that the average suggests they do. And then to increase sports participation with a special attention to disadvantaged groups, particularly as findings at the national level indicate girls, those of lower income, those in different geographic regions, and race or ethnicity or disability status. Our next indicator is active play. So active play is rated on two criteria. The primary criteria is the percentage of children and youth who engage in unstructured and unorganized active play for several hours a day. And the secondary criteria is the percentage of children and youth who report being outdoors for several hours a day. Now you can see in this indicator we assigned a grade of incomplete, both to the indicator itself and the data quality. And that's largely due to the fact that there was no data available. So we couldn't grade the indicator, and we couldn't grade any data since there were none. However, we include this indicator in our report card for two reasons. One, this is an important component of physical activity for children and youth. Active play can add to a child's overall daily physical activity. So we think it's an important aspect to measure. While it's not being measured currently, we want to include it in our report card so that in time we can rate it when data become available. And of course, the second reason is it was included in the National Physical Activity Report Card, and we'd like to be able to compare our results at the local level to national results. Our recommendations go to the need to implement local surveillance of active play and outdoor play, as well as providing resources to parents and youth to encourage active play, and implementing or expanding programs that encourage active play, such as research, recess, physical activity breaks at school, and so on. Our next indicator is physical fitness. So the primary criteria for this indicator is the percentage of children and youth who meet the criterion referenced standards for cardiorespiratory fitness. And then secondary criteria are the percentage of children and youth who meet criterion reference standards for muscular strength and muscular endurance. In this indicator, we assigned a grade of incomplete to the indicator itself and a data quality grade of F. So we assigned a grade of incomplete to the indicator because we did not have access to data to evaluate the indicator. However, we assigned a data quality grade of F to this indicator because there do exist some data, however, they were unavailable to us. So schools can collect this sort of data with a fitnessgram tool. However, in Kansas and Missouri, we were unable to obtain those data. So we would recommend that surveillance is established of physical fitness for local children and youth, and we'd like to coordinate those existing fitnessgram assessments to obtain local results at the school district or school level. We'd like to provide opportunities to local children and youth to engage in aerobic and muscle strengthening activities at a sufficient intensity and frequency to improve physical fitness, and we encourage the reporting of those fitness test results. Our next indicator is family and peers. The primary criteria in this indicator is the percentage of family members who facilitate physical activity and sport opportunities for their children, for example, through volunteering, coaching, driving, paying for membership fees, and equipment. Secondary criteria for this indicator are the percentage of family members who are physically active with kids and the percentage of children and youth with friends or peers who encourage them to be physically active. This is another indicator where we didn't assign a grade to the indicator itself or to the data quality because there were no data available. There's no systematic data surveillance of this sort of information at the local or national level. So we rated the data quality incomplete. And our recommendations are to provide programming to enhance parent support and modeling of physical activity, and to establish this regional surveillance of parent and peer support for physical activity. Our next indicator is the school indicator. This is a really comprehensive indicator of physical activity, and so we have multiple secondary criteria, as you can see. The primary criteria in this indicator is the percentage of schools with active school policies. For example, daily physical education, daily physical activity breaks, recess, an every way and plays approach, bike rides at school, traffic calming on school property, outdoor time. Then, some of the secondary criteria include the percentage of schools where the majority of students are taught by a PE specialist, the percentage of schools where the majority of students are offered the mandated amount of PE, the percentage of schools that offer physical opportunities beyond PE to the majority of their students, the percentage of parents who report their children and youth have access to physical activity opportunities at school in addition to PE, and the percentage of schools with students who have regular access to facilities and equipment that support physical activity. So this indicator was graded incomplete, and then our data quality grade was an F. So before I get into all the findings, I'll explain the rationale behind those ratings. While there is a fair amount of data available in this indicator, there was no data available at the local level. All the data points that you'll see in our key findings relate to, at the most specific, the state level, and in some cases it may only be national level data or none available at all. So while we provide this information to get a sense of the state level findings, we were in discussion with our core work group, decided not to rate the indicator or to give it an incomplete. Since there was such a quantity of data available, we did give a grade to the data quality, and we gave it an F because none of it was available at the local level, and in some cases it's not recent, or in other cases it's not necessarily a representative or sufficient sample. So for those reasons, we gave the grade of an F. Now I'm going to briefly summarize some of the findings in this indicator. The primary criteria for the indicator was the percentage of schools with active school policies, and that can be a broad range of different policies. However, there's a couple findings here that indicate the state level rates of or policies relevant to physical activity education. So there's no Kansas state law requiring a certain amount of PE per school per week in elementary, middle, or high school. There's no Missouri state law requiring a certain amount of PE in high school. Another active school policy is recess, and Missouri requires 20 minutes of recess in elementary school and a minimum of 120 minutes of physical activity time, which could include PE in elementary school. Kansas only recommends recess but doesn't require it. But 100% of Missouri schools have a recess requirement due to state law. There's a couple state level, There's a couple state policies relevant to PE credits, both in Missouri and Kansas, which require some PE credits for high school graduation. And we have a little information about the percentage of high school students who attend daily physical education in Kansas and Missouri, which is around 28 to 30%. And we have a little information about the percentage of Kansas and Missouri high school students that attended physical education on 5 days in an average school week from 2017, so a more recent source, and that was between 25 and 29%. So more recent data is maybe a little bit lower. And then we finally have a little information about the percentage of schools in Kansas and Missouri that have comprehensive physical activity plans, and that is very low, only 0.8% of Kansas and 3.1% of Missouri schools. So the next page goes into the remaining indicators, criteria in this indicator. We have a little information about the state percentage of schools that have students taught by a PE specialist. So it's about 87% of Kansas and 83.2% of Missouri schools have a PE teacher or specialist who received professional development on PE or physical activity in the previous year. We don't have any data sources available on how many students were offered the mandated amount of PE, although we presume it should be close to 100. We have a little information at the state level about schools who offer physical activities beyond PE. So we have about 47.7% of Kansas and 49.7% of Missouri secondary schools have physical activity breaks in the classroom. Again, around 50% of Missouri and Kansas secondary schools have physical activity opportunities before the school day. A higher percentage of Kansas and Missouri secondary schools have physical activities after the school day. And then a little bit of a difference between Kansas and Missouri in terms of how many offer intramural sports or physical activity clubs, where it's about 40% of Kansas and almost 60% of Missouri secondary schools have those clubs available to students. A relatively large percentage of Kansas and Missouri secondary schools offer interscholastic sports, between about 85% in Missouri and almost 95% in Kansas. Again, a large percentage of Kansas and Missouri secondary schools have a school health council that assesses the availability of physical activities opportunities for students, around 80 to 86% in the two states. And then again, a largish, moderate percentage of Kansas and Missouri secondary schools have a joint use agreement that allows for the shared use of their school or community physical activity opportunities or facilities. We don't have any information about parents reporting children having access to physical activity opportunities beyond PE, or schools with students who have regular access to facilities or equipment that supports their physical activity. So we found a lot of these data points from a few sources, including The Shape of the Nation, which is a national report that includes data at the state level, and it's based on the results of a survey that were completed by physical education coordinators from states and a scan of the legislation at the state level. So again, it's a state level source. It's reported regularly, but the most recent edition's at least 4 years old now. Our next source was the YRBSS. It's a national report and has state level data. And then the National Physical Activity Plan Alliance Report Card reported results at the state level within the past 2 years. And the School Health Profiles study provides information at the state levels on policies related to PE, physical activity, and health education. And they're reported regularly. The most recent one was in 2018. So again, going into our discussion of this indicator, because of that lack of local data, we were not able to assign a grade. And we noted that while both states require some PE credits for graduation in high school, since there's no laws in Kansas requiring a minimum number of PE minutes for any grade level, and since Missouri has no laws establishing a minimum PE amount in high school, it's possible that some students get no physical activity per school week whatsoever. Some, of course, may, depending on the district or individual school, be receiving a fair amount of physical activity, but based on the policies at the state level, there's no way to guarantee that all students do. So our discussion continues here, looking at the indicator criteria for the quality of PE instruction. And we have information at the state level that some instructors do get specialized training, but it doesn't reflect the ability or the availability of physical education opportunities. So while some instructors may be getting specialized training, that does not necessarily translate into all students receiving PE. So given the fact that we only had state level data and the proportions allow for the possibility that some students aren't receiving much physical activity, whether in the classroom through PA breaks or recess or through physical education or before or after school, we just couldn't give a grade to this indicator. We have a couple recommendations for the indicator. We'd like to establish local surveillance of physical activity in schools through surveys of parents, staff, and administrators. In particular, we want to survey the number of students taught by a PE specialist, whether students are offered the mandated amount of physical education, how many schools are offering physical activity opportunities beyond PE, whether parents are reporting their children have access to those activity opportunities beyond PE, students reporting that they have regular access to schools or to facilities or equipment that support their physical activity. And we also think that it's important that at the statewide level that we implement some standards for recess and PE. Our last indicator is the community and built environment indicator. This one has several criteria. The primary criteria is the percentage of communities or municipalities that report they have infrastructure specifically geared toward promoting physical activity. And then the secondary criteria are the percentage of children or parents who report having the facilities, parks, programs, and playgrounds available to them in their community, the percentage of children or parents who report living in a safe neighborhood where they can be physically active, the percentage of children or parents who report having well-maintained facilities, parks, and playgrounds in their communities that are safe to use. So the grade for this indicator is a C-, and the data quality grade is a B. That grade in the indicator is supported by the key findings for this primary criteria of communities with infrastructure promoting physical activity. So in the Children's Mercy Community Health Needs Assessment, they found that about 78.1% of children live in a neighborhood with sidewalks. Then the Missouri County level study found that anywhere between 31.56 and 37% of residents in the region have roads and streets with shoulders or marked lanes for bicycling in their community. And then somewhere between 65 and 83% of Kansas City residents have sidewalks in their neighborhood. That secondary criteria of children or parents who have facilities, programs, or parks or playgrounds in their area, we found a few findings, data points in this criteria, including the percentage of residents who live in a census block that's, if they're in an urban area, less than half a mile of a park or otherwise recreation facility, and if they're in a rural census block, less than a mile of such facilities. If they're in a suburban area, less than a mile from the recreational facility, and if they're in a rural area, less than 3 miles. So that was anywhere between 83% of folks in Platte County up to 95% of Johnson County residents. And that came from the County Health Rankings and Roadmaps program. The health needs assessment found about 83 to 95% of residents have access to exercise opportunities. The next criteria was children or parents who report living in a safe neighborhood. And so a couple data points here point to that. The health needs assessment found about 12% of children live in a slightly or not at all safe neighborhood, and 9% live in neighborhoods with graffiti or vandalism. We also found that about 18% live in neighborhoods where there's usually litter or loose garbage on the street or sidewalk. And then between 74.45 and 90.23% of the residents consider their neighborhoods to be safe or quite safe or extremely safe. So quite a high percentage there. A couple other considerations that are informing our discussion of this indicator is the percentage of the population living in a highly walkable neighborhood, which is about 29.7%. This is based on data collected by the EPA, which is put into something called the Walk Index. We calculated the percentage of the population that lives in an area that's highly walkable based on the density of the area and the facilities within walking distance. So our data sources here include the Children's Mercy Health Needs Assessment, which we've rated as a high-quality data source, the Missouri County level study, which is high-quality data source, but limited in that it only is representative of Missouri counties, the County Health Rankings and Roadmaps program, which is a high-quality data source. It's publicly available, recently reported, and uses a sufficient sample size. And then the EPA Walkability Index, which is publicly available and tied to census block groups, so it's considered to be representative and have a sufficient sample size. But the data were collected in 2010. So our discussion of this indicator kind of focuses on the primary criteria, so the proportion of residents who report they have various kinds of infrastructure geared toward promoting their physical activity. And so there are high rates of residents living in neighborhoods with sidewalks, around 78.1%, but far fewer residents in Missouri counties, at least, live in an area with marked bike lanes, between 31 to 37%. So there's unfortunately no data source in Kansas that looks at bike lanes. The secondary criteria in the indicator include those looking at parks and recreation centers. And compared to statewide estimates, residents in the Kansas City area actually live in a higher proportion of residents in the Kansas City area live in areas close to these facilities, which is possibly due to the fact that this is a metropolitan area and a lot of Kansas and Missouri residents are living in more rural areas. And the majority of residents live in an area that they consider to be safe. But there may be some geographic disparities which may align with racial and ethnic and socioeconomic divisions as well. So, given the fact that lower proportions live in a highly walkable area compared to the proportion of people who live in an area with sidewalks, and the variability in whether people live near parks or recreation facilities or have access to bike lanes, we decided to give this indicator the grade of a C-. And this is also based on the discussion with subject matter experts, and which highlighted that the lack of available data on other important factors that influence the use of the built environment. So, there have been surveys detailing the number of sidewalks in a community, but there's not been a lot of data collected on the quality of those sidewalks and whether they have actually been connected to anything people might want to walk to. So those factors may be important to consider when we think about the quality of the built environment. Again, other things that were missing in the data was, regarding safety. While neighborhood safety was assessed by asking parent perception of the neighborhood, safety might also be referring to pedestrian safety, which is affected by traffic speed and could be assessed, was not assessed by any of the measures in the indicator or even in the national report card. So we did assign a grade of a C-. And in terms of the quality of the data, there were high-quality data sources available, but we weren't able to get data for some of the indicator criteria, such as well-maintained parks, facilities, and playgrounds. And so, again, with discussion with our subject matter experts on the fact that we're lacking data on certain aspects of safety in the built environment, we, again, established our data quality grade of a B. Our recommendations on this indicator are to establish surveillance of a broader range of built environment facilities like bike lanes, trails, and so on, and to provide information about neighborhood safety and facilities in conjunction with the information about race, ethnicity, and socioeconomic status of residents. We also think that improving access and equity to facilities and infrastructure to support physical activity is important, and we'd like to assess the additional criteria in this indicator, including traffic safety regulations and trail and sidewalk connectivity. So that's the last of our indicators. This page is going to include our references, so if you want to access any of the data sources that were used in the report card, this is where you can go. There's links to those sources in this list. And here's the next list, the remainder of the list. So again, thank you for bearing with me through the duration of this report card. You can review any of the information I discussed in the document itself, and always feel free to reach out to myself, Elizabeth Wilson, EJ Wilson at cmh.edu, if you have questions about the report card, or anyone on the weighing in team, and we'd be happy to talk with you and give you more information.